Hey everyone, hope you're having a great day. You're listening to the RX Daily Dose. Today's episode is being recorded for Monday, January 3rd, and I'm your host, Ian Parnagoni. We update this podcast for healthcare providers, medical professionals, and anyone who has an interest in drug updates. Don't forget to like, share, and subscribe on all your favorite podcast platforms and social media, including iTunes, Spotify, YouTube, and Instagram. All links can be found in the show notes below. So in today's episode, we have updates which include an EUA for molnupiravir for treatment of COVID-19 and approval of Apretude as a new treatment option for PrEP. We'll also go over approval of Vivgart for myasthenia gravis and approval of Spire for severe asthma. As always, feel free to skip around. I'm going to include times in the show notes so you get the drugs that interest you. First up for today, the FDA issued an emergency use authorization for Merck's molnupiravir for the treatment of mild to moderate coronavirus disease in adults with positive results of direct SARS-CoV-2 viral testing and who are at high risk for progression to severe COVID-19, including hospitalization or death, and for whom alternative COVID-19 treatment options authorized by the FDA are not accessible or clinically appropriate. Molnupiravir is available by prescription only and should be initiated as soon as possible after diagnosis of COVID-19 and within 5 days of symptom onset. Molnupiravir is not authorized for use in patients younger than 18 years of age because molnupiravir may affect bone and cartilage growth. It is not authorized for the pre-exposure or post-exposure prevention of COVID-19 or for initiation of treatment in patients hospitalized due to COVID-19. Molnupiravir is not a substitute for vaccination in individuals for whom COVID-19 vaccination and a booster dose are recommended. The FDA has approved one vaccine and authorized others to prevent COVID-19 and severe clinical outcomes associated with a COVID-19 infection. The FDA urges the public to get vaccinated and receive a booster if eligible. Molnupiravir is a medication that works by introducing errors into the SARS-CoV-2 virus genetic code, which prevents the virus from further replicating. Molnupiravir is administered as 4 200 milligram capsules taken orally every 12 hours for 5 days for a total of 40 capsules. Molnupiravir is not authorized for use for longer than 5 consecutive days. As a reminder to everyone, the issuance of an EUA is different than an FDA approval. In determining whether to issue an EUA, the FDA evaluates the totality of scientific evidence available and carefully balances any known or potential risks with any known or potential benefits of the product. Based on the FDA's review of the totality of scientific evidence available, the agency has determined that it is reasonable to believe that molnupiravir may be effective for use as treatment of mild to moderate COVID-19 in certain adults when alternative COVID-19 treatment options are not accessible or clinically appropriate. The primary data supporting this EUA for molnupiravir are from Move Out, a randomized, double-blind, placebo-controlled clinical trial studying molnupiravir for the treatment of non-hospitalized patients with mild to moderate COVID-19 at a high risk for progression to severe COVID-19. Patients in the study were adults 18 years of age and older with a pre-specified chronic medical condition or at increased risk of SARS-CoV-2 infection for other reasons who had not received a COVID-19 vaccine. The main outcome measured in the trial was the percentage of people who were hospitalized or died due to any cause during 29 days of follow-up. Of the 709 people who received molnupiravir, 6.8% were hospitalized or died within the time period, compared to 9.7% of the 699 people who received a placebo. Of the people who received molnupiravir, 1 died during the follow-up period compared to 9 people who received placebo. Side effects observed in the trial included diarrhea, nausea, and dizziness. The safety and effectiveness of molnupiravir for the treatment of COVID-19 continues to be evaluated. Based on findings from animal reproductive studies, molnupiravir may cause fetal harm when administered to a pregnant individual. Therefore, molnupiravir is not recommended for use during pregnancy. Molnupiravir is only authorized to be prescribed to a pregnant individual after the prescribing healthcare provider has determined that the benefits of being treated with molnupiravir would outweigh the risks for that individual patient, and after the prescribing healthcare provider has communicated the known and potential benefits and the potential risks of using molnupiravir during pregnancy to the pregnant individual. The FDA also issued a new approval for cabotegravir, which goes by brand name Apretude, as an extended-release injectable suspension for use in at-risk adults and adolescents weighing at least 35 kilograms for pre-exposure prophylaxis, also known as PrEP, to reduce the risk of sexually acquired HIV. Apretude is given first as 2 initiation injections administered 1 month apart, and then every 2 months thereafter. Patients can either start their treatment with Apretude or take oral cabotegravir, known as Vocabria, for 4 weeks to assess how well they tolerate the drug. According to the CDC, notable gains have been made in increasing PrEP use for HIV prevention in the US, and preliminary data show that in 2020, about 25% of the 1.2 million people for whom PrEP is recommended were prescribed it, compared to only about 3% in 2015. However, there remains significant room for improvement. PrEP requires high levels of adherence to be effective, and many interpersonal factors such as substance use disorders, depression, poverty, and efforts to conceal medication can impact that adherence. It is hoped that the availability of long-acting injectable PrEP option will increase PrEP uptake and adherence in these groups. The safety and efficacy of Apretude to reduce the risk of acquiring HIV were evaluated in 2 randomized double-blind trials that compared Apretude to Truvada, a once-daily oral medication for HIV PrEP. Trial 1 included HIV uninfected men and transgender women who have sex with men and have high-risk behavior for HIV infection. Trial 2 included uninfected cisgender women at risk for acquiring HIV. Side effects occurring more frequently in participants who received Apretude compared to participants who received Truvada in either trial include injection site reactions, headache, pyrexia, fatigue, back pain, myalgia, and rash. Apretude includes a boxed warning to not use the drug unless a negative HIV test is confirmed. It must only be prescribed to individuals confirmed to be HIV negative immediately prior to starting the drug. Drug-resistant HIV variants have been identified in people with undiagnosed HIV when they use Apretude for HIV PrEP. Individuals who become infected with HIV while receiving Apretude for PrEP must transition to complete HIV treatment regimen. The drug labeling also includes warnings and precautions regarding hypersensitivity reactions, hepatotoxicity, and depressive disorders. Apretude was granted a priority review and breakthrough therapy designation, and the FDA granted the approval to Viv Healthcare. The FDA also approved Efgartigimod, which goes by brand name Vivgart, for the treatment of generalized myasthenia gravis in adults who test positive for the anti-acetylcholine receptor antibody. Myasthenia gravis is a chronic autoimmune neuromuscular disease that causes weakness in the skeletal muscles, that worsens over periods of activity and improves over periods of rest. Myasthenia gravis affects voluntary muscles, especially those that are responsible for controlling the eyes, face, mouth, and limbs. In myasthenia gravis, the immune system produces acetylcholine receptor antibodies that interfere with communication between nerves and muscles. This results in weakness, and severe attacks of weakness can cause breathing and swallowing problems that can be life-threatening. Vivgart is the first approval for a new class of medication. It is an antibody fragment that binds to the neonatal Fc receptor, preventing Fc receptor from recycling immune globulin G back into the blood. The medication causes a reduction in overall levels of immune globulin G, including the abnormal acetylcholine receptor antibodies that are present in myasthenia gravis. The safety and efficacy of Vivgart were evaluated in a 26-week clinical study of 167 patients with myasthenia gravis, who were randomized to receive either Vivgart or placebo. The study showed that more patients with myasthenia gravis with antibodies responded to treatment during the first cycle of Vivgart, compared to those who received a placebo, on a measure that assesses the impact of myasthenia gravis on daily function. More patients receiving Vivgart also demonstrated response on a measure of muscle weakness compared to placebo. The most common side effects associated with the use of Vivgart include respiratory tract infections, headache, and urinary tract infections. As Vivgart causes a reduction in IgG levels, the risk of infections may increase. Hypersensitivity reactions such as eyelid swelling, shortness of breath, and rash have also occurred. Patients using Vivgart should monitor for signs and symptoms of infection during treatment, and healthcare professionals should administer appropriate treatment and consider delaying administration of Vivgart to patients with an active infection until the infection is resolved. And finally for today, the FDA approved Tessa Pelimab, which goes by brand name Spire, an injection as an add-on maintenance treatment used to improve severe asthma symptoms when used with a patient's current asthma medicine. Spire is approved for adults and children aged 12 years and older with severe asthma not controlled by their current asthma medicine. Spire is the first asthma treatment targeting thymic stromal lymphopoietin, a molecule involved in airway inflammation. Spire is also the first treatment for severe asthma that is not limited to a specific type of severe asthma. Spire is administered once every 4 weeks by a healthcare professional through a subcutaneous injection. Asthma is a long-term inflammatory disease that causes the airways of the lungs to become swollen or inflamed and can be triggered by several factors, including allergen or irritant exposure and viral infections. An asthma attack can include wheezing, cough, chest tightness, and make it hard to breathe. Severe asthma attacks can be intense, last for long periods of time, and impact daily activities. Severe asthma symptoms usually do not get better with use of short-term treatments, and approximately 5 to 10% of Americans with asthma have severe asthma. Safety and effectiveness of Spire were demonstrated in 2 clinical trials, where participants with severe asthma received Spire 210 milligrams or placebo subcutaneously once every 4 weeks for 52 weeks. Participants receiving Spire had significant reductions in the annualized rate of severe attacks compared to placebo. Additionally, there were fewer asthma attacks requiring emergency room visits and hospitalization among participants treated with Spire compared to placebo. Spire should not be used to treat short-term asthma symptoms or short-term asthma attacks. Patients should not discontinue systemic or inhaled corticosteroid treatment after starting therapy with Spire. Reductions in corticosteroid treatment dose, if appropriate, should be made gradual and performed under the direct supervision of a healthcare professional. Patients with a serious hypersensitivity reaction to Spire must not take Spire. Live vaccines should be avoided in patients receiving Spire. And that's all I have for right now. I hope you enjoyed today's episode. I'll include all links in the show notes below, so please go back and check those out too. Please connect with me on any of your social media platforms and give me feedback on what you heard today. I'd love to know what you thought about the episode. And as always, feel free to like, share, and subscribe wherever you listen to your podcasts. And thank you so much for tuning in. Stay safe out there, and I hope you enjoy the rest of your day.